Hi all, just thought I'd make a quick video today for all those that believe hook, line and sinker, all the absolute so-called facts coming from the government, re the coronavirus. I just thought I'd make a quick video with James Corbett, who is my favourite conspiracy fact researcher. I have cherry-picked it, so if you want to see the full show, go to the link below. Also, he backs up all his claims with publicly available documents, and the link below here is for his show notes, which has links to all those documents to back up his claims. As you can see, things are not quite as what they're telling you, and I have to say I don't necessarily believe in everything he says with regard to the longevity of any new sanctions or as he calls them, draconian lockdown measures. I don't necessarily think they are going to stay in place for long times, but as he says, all they need to do is flick the switch and it will happen. So please enjoy his show, Lies, Damn Lies and Coronavirus Statistics.
Yes, I am here today to inform you, in case you somehow managed to miss it, that the models, projections, guesstimates, case fatality rates, infection numbers, and various other statistics that have been thrown at the public in the past few months to justify the shutdown of the global economy, the implementation of a draconian police state, and the rewriting of all social norms and rules has been a bunch of manipulated, phony hooey.
First, I want to say that in 30 years of public health medicine, I have never seen anything like this, anything anywhere near like this. And I'm not talking about the pandemic, because I've seen 30 of them, one every year. It's called influenza and other respiratory illness viruses that we don't always know what they are. But I've never seen this reaction. And I'm trying to understand why. And I have to say, I really feel for my colleagues that are in public health practice. It's easy for me to sit in the armchair of my office and look at this and observe it and be critical or have ideas. But I really feel for them for three reasons. One is that the data they're getting is incomplete to really make sense of the size of the threat. We're getting very crude numbers of cases and deaths, very little information about testing rates, contagious analysis, severity rates, who's being hospitalized, who is in intensive care, who is dying, what are the definitions to decide if someone died of the coronavirus or just died with the coronavirus. There's so much important data that is very hard to get to guide the decision about how serious the threat is this. The other part is that we actually do not have that much good evidence for these social distancing methods. There was just a couple of reviews in the CDC Emerging Infectious Diseases Journal, which showed that although some of them might work, we don't really know to what degree, and the evidence is pretty weak. So the third problem is the pressure that is being put on our public health doctors and our public health leaders, and that pressure is coming from various places. The first place it came from was the Director General of the World Health Organization, when he said this is a grave threat and public health enemy number one. I've never heard Director General of the WHO use terms like that. Then at the announcement of the pandemic, he said he's doing it because of a grave, alarming, quick spread of the disease and an alarming amount of inaction around the world. That puts a huge pressure on public health doctors and leaders and advisors, and a huge pressure on governments. And then you get this, what seems like a cascade of decision-making that really puts pressure on countries and governments, provincial, states, to sort of keep up with this action that was, that Dr. Hoffman said that we're trying to avoid or should avoid, which is an overreaction. I don't know what's an appropriate reaction, but I do know that I'm having trouble figuring this out.
Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
Yes, we are constantly exhorted to listen to the experts and only trust the people who are the credentialed, accredited scientists working in the field, unless they disagree with the alarmist narrative, in which case they must be ridden out of the history books, airbrushed out of the picture, Stalin, Soviet Russia style. And that is exactly what has happened with the dozens of scientists, prominent researchers in relevant fields, who are stepping up to contradict the alarmist narratives that are being put forth right now. And in order to understand that these are not fringe lunatic quacks, these are accredited, credentialed, awarded, respected experts in their field, and all of the other things that we are always told to bow down before, these are those types of people. And in order to document that, I will put on the record a couple of great articles from off-guardian.org that I hope everyone has in their info arsenal. One is called 12 Experts Questioning the Coronavirus Panic, and the follow-up is called 10 More Experts Criticizing the Coronavirus Panic. There are dozens and dozens and dozens of very prominent people who are speaking out against the panic that is being fomented on the back of the dodgy numbers and questionable science that is this pandemic panic. And long story short, they do come up with some pretty startling numbers that did become the basis for at least the immediate proximal cause of the incredibly draconian lockdown measures that were introduced specifically in the US and UK, although obviously this did affect decisions being taken place in Canada and many other places around the world to lock down, based on some very alarming numbers of the number of deaths that would be likely to occur if this disease were left to run its course, running into 500,000 in the UK and 2.2 million in the US. Startling numbers that certainly were reported at the time.
If we don't do anything to control this virus, over 80% of people in the U.S. would be infected over the course of the epidemic, with 2.2 million deaths from COVID-19. That 2.2 million deaths also doesn't account for the potential negative effects of health systems being overwhelmed.
Think of the number, 2.2, potentially 2.2 million people if we did nothing. If we didn't do the distancing, if we didn't do all of the things that we're doing.
Of course, those numbers have been walked back, but there are any number of explainers out there on the internet that will inform you that no, these numbers haven't been fundamentally changed. It wasn't that the model was completely and utterly off. No, you see, what he was saying, what Neil Ferguson and his comrades there at the Imperial College were saying, is that if no distancing measures, no lockdown took place, then there would be widespread, unbelievable, monumental death, the likes of which we haven't seen in X number of years. But since that took place, that's why it will be under. The problem with that theory is that in the paper itself, they very explicitly and clearly highlight the 2.2 million deaths, the 500,000 deaths figures. But any sort of, well, if we took these measures, it would be under 20,000, is very much, you have to scry the tea leaves to figure it out. But don't worry, Neil Ferguson, of course, knew that weasel was embedded in the report itself, which is why he came out on Twitter to clarify. He said, "I think it would be helpful if I cleared up some confusion that has emerged in recent days. Some have interpreted my evidence to a UK parliamentary committee," where he said deaths could be kept under 20,000 now, from 500,000 a month ago, as indicating we have substantially revised our assessments of the potential mortality impact of COVID-19. This is not the case. Indeed, if anything, our latest estimates suggest that the virus is slightly more transmissible than we previously thought. Our lethality estimates remain unchanged. My evidence to Parliament referred to the deaths we assess might occur in the UK in the presence of the very intensive social distancing and other public health interventions now in place. Without those controls, our assessment remains that the UK would see the scale of deaths reported in our study, namely up to approximately 500,000. Interpretation, well, we said 500,000 deaths in the UK because there was nothing in place at the time. That was put in place. Now it will be under 20,000. So what exactly are we testing this against? What is the reality against which this is being tested? Which is to say, like all models, none. It is garbage in, garbage out. And because, don't worry, it's actually better than we thought, because our alarmist numbers scared governments into enacting policies that now are exactly what we wanted, and now there will be less deaths.
Kelly, what do you think the strategy was behind releasing these projections?
Well, I think there were two objectives. I think the first was, frankly, to scare people.
What? Politicians cynically latching on to hyped up scientific models in order to scare the public into accepting things that they otherwise wouldn't? Surely not. Yes, surely so. It does happen, and it's going to continue to happen as long as people continue to fall for the same lies over and over. Don't worry, the magicians at these institutes, these scientists floating on clouds, who would never have any sort of political motive for anything, and certainly haven't received $79 million of funding from the Bill and Melinda Gates Foundation this year alone, as Imperial College has, would never have any reason for skewing any of their results or making anything seem hyperbolic or alarmist in order to scare people into accepting various policies. Now, previously, we have heard estimates of up to 200,000 Americans dying from people like Anthony Fauci. That's much lower than the 2.2 million that we were being told just a month ago, but it has been revised downwards from 2.2 million to 200,000, 100,000, 81,000. Now, of course, that has been revised downwards again. Now the Institute for Health Metrics and Evaluation at the University of Washington is now estimating a peak of 60,000 deaths by COVID-19 by August of this year. So that continues to get ratcheted downwards, and no doubt once again the politicians will be able to pat themselves on the back to say, see, we saved you. There would have been millions dead. Now there are only tens of thousands, and we did it. So garbage in, garbage out. But once again, please don't take my word on that aspect of these models. Take, Anthony Fauci's.
I'd like to start with the question of these models, which are now getting a lot of pushback in terms of their reliability when the numbers have swung, 33% in just a couple of days. What do you say to Andy McCarthy, who wrote that piece?
Well, I mean, there's a certain validity to it. I have been and still am and will always be somewhat reserved and skeptical about models, because models are only as good as the assumptions that you put into the model. And those assumptions that start off when you don't have very much data at all, or the data that you have is uncertain, that you put these assumptions in and you get these wide ranges of calculations of what might happen, 100,000 to 240,000 deaths.
In that case, now we have these death estimate models. Millions will die unless you do what we want, and then you do what we want. There, you see, we saved you. We saved you from the millions that were going to die in these models that we now admit are flawed. One understands how that game works, but again, for a slightly more detail on this, and from someone who knows a thing or two what he is talking about, let's go to Del Bigtree's recent conversation with Knut Witkowski, Dr. Knut Witkowski, who has talked at length about these models and the fact that they are indeed garbage in, garbage out, which is to say, worthless.
At what point did you break away from believing in the imperial model? How early on did you start suspecting it was wrong?
From the very beginning, I never believed in it.
Why?
Well, because it didn't make any sense. And the problem is some people put out models that have no relation to reality, and then you can prove everything, including the opposite. We should use models that are actually grounded in reality. And if we do that, we get realistic estimates. They can be 10% too high or even 20%, but they will not be off by several orders of magnitude.
When you say proper models or using real numbers, I think around the world we assumed that's what was being used. What were these models built on?
I have no clue, because I couldn't see any information that would allow me to evaluate what type of model was used, other than it started with M and ended with Otto. No qualified or very few qualified epidemiologists were ever being consulted. It was all virologists and MDs, and they are not really trained in understanding the complex nonlinear systems that drive epidemics and that you have to incorporate in your thinking to make sense of the data.
Yes, the only thing verifiable about these overinflated, hyped, scaremongering models is that they start with M and end with Otto. But I think we understand how this scam really works, and I think we should know by now, because it's the same scam, fundamentally, that's been perpetrated on the public for thousands of years at this point. And whereas in the days of old, it was the priestly class trying to convince the masses that next week the snake god is going to swallow the sun, and if I don't do the special magic ritual, then the snake god will swallow the sun forever, and we're all gonna die. And lo and behold, the next week, the solar eclipse arrives at the predicted time, and the special magic ritual goes on, and the snake god lets go of the sun, and it's because of me, and thus you must worship me. I am your king. This is how the scam has always worked, and in the modern context, you have the modern priestly class saying, if you don't do exactly what we say and shut down the entire global economy, lock people in their homes, and stop all productive human activity, then millions are going to die, and when millions don't die, you see, it's because of us. Of course, this is inherently unfalsifiable and therefore unscientific, but this is the way the scam works, and it has that scientific gloss. Does it not? So it certainly sounds good until actual scientists come in and say this is based on nothing. Garbage in, garbage out, which, even as I point out, even Anthony Fauci comes along and says, well, yes, I agree. These models are only as good as the data we have to go into it, and we didn't have much data to go into it. So they admit the scam, but only after they have already gotten what they wanted out of it. And if only these manipulated projections and models were the only fudged numbers that we were dealing with right now, but unfortunately, as I'm sure you are aware, that is not the case. And perhaps the number that is most front and center in all coverage of the COVID-19 crisis is the death count. People are dying left and right. The bodies are piling up. Look at the numbers every day. What is the new death count today? The death count has topped the X number of thousands. Oh my God. The bodies. And this is, of course, what people are concentrating on. And obviously so. You obviously, as Fauci and everyone else admits, you can argue about models and projections and things like that. But you can't argue about dead bodies, can you? They exist. They are countable. There is a body count. So clearly, we have some sort of proof of this, do we not? How can you fudge this? How can it be possible that you fudge this? And it's important to understand, as something that many of the dissenting scientific voices are pointing out right now, so many of the different statistics and measurements and ways that we could theoretically get a handle on what actually is happening through numbers are not reliable because the criteria are being changed in the middle of this crisis. So that we can't compare apples to apples with any of these numbers on so many different levels, one great example of which is the simplest of all the questions. There is a body count. This is not some theoretical pie-in-the-sky thing. People have died from a disease. How many people? This should not be a difficult thing to determine. But it is because, of course, that stat continues to change, or the metric by which that stat is calculated continues to change, because it is a calculation. It is an estimation. It is something that is written down on a death certificate by a doctor working on certain guidelines. So here's a prime example of that. You may have seen this very scaremongering headline in recent days. This one, let's take it from The Guardian. It was in the New York Post and elsewhere, but on The Guardian has New York City coronavirus death toll jumps past 10,000 in revised count. Revised count? What does that mean? So as this story goes on to say, New York City has revised its COVID-19 death toll sharply upwards to more than 10,000 people, hitting an important psychological milestone. We're in the 5 digits now, people. And it happened overnight, just like that, because they changed the criteria. With the city now firmly established as being at the heart of the global coronavirus crisis, and it jumped into that top position because of this change. The soaring death toll has been fueled by the adding of 3,778 people who were not tested for COVID-19, but are presumed to have died from it. All right, well, there you go. So this is the criteria that we're using. Well, they probably had it, so let's just add them. And now it's 10,000. Well, there you go. So as you can see, we cannot take these numbers at face value. They are judgment calls, and you might agree with the judgment that's being made, but the underlying point is that the numbers are clearly a political product. They are the result of guidelines that are being issued and judgment calls that are being made by not even political figures. We're talking about appointees who were not elected by anyone. And in this case, quite specifically, of course, in the U.S. context, we're talking about the CDC, and that's the example we can turn to. We already heard earlier in this program about Dr. Scott Jensen talking about the ways that the CDC has changed their death coding guidelines for COVID-19 and how he, as a practicing doctor, finds that absolutely incredible. And he talks about that, so I will throw you back to that interview. I suggest you check it out in its entirety for more of that context. But let's look at that in some more detail. Let's take it from the CDC itself, which on March 24th, 2020, issued COVID-19 Alert Number 2, new ICD code introduced for COVID-19 deaths, introducing U07.1 as a new ICD code, basically a code for death certificates to code for COVID-19 death. And if you read through this document, it says, will COVID-19 be the underlying cause? And it says the underlying cause depends upon what and where conditions are reported on the death certificate. However, the rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. So they admit they are changing the guidelines specifically to make COVID-19 more likely to be classified as the underlying cause of death. And in a later section, it says, what happens if the terms reported on the death certificate indicate uncertainty? Well, yeah, that's a good question. What if we don't know exactly what the cause of death was? It says, if the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD code. Please bear in mind what that is saying. If it is probable or likely COVID-19 related, then it was cause of death COVID-19. That's how you code it. And it is saying it is not likely that NCHS will follow up on these cases. They are letting the doctors know, don't worry, we're not going to check into it. We're not even gonna examine it ultimately. You just code for it. It's a COVID-19 death. Just add it to the death number, please.
Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and we'll I mean, the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Professor Walter Ricciardi, advisor to Italy's health minister, explained this, the Italian incredible number of deaths being reported, was caused by the generous way the Italian government handles death certificates. The way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. They go on to talk about Germany. On March 20th, the president of Germany's Robert Koch Institute confirmed that Germany counts any deceased person who was infected with coronavirus as a COVID-19 death, whether or not it actually caused death. Ireland, Northern Ireland's HSC Public Health Agency is releasing weekly surveillance bulletins on the pandemic. In those reports, they define a COVID death as individuals who have died within 28 days of first positive result, whether or not COVID-19 was the cause of death. And I could go on and on and on and on about the statistics and the tests and the various ways that the numbers that they are using to scare you with can and are being fudged, manipulated, cooked, and otherwise hyped. And I think a good article for getting down to that base root of what is going on and why it is important to be exposing the statistical chicanery that's taking place was published to whatsupwiththat.com in the last week by Charles Rotter. It's an article entitled Coronavirus Death Predictions Bring New Meaning to Hysteria. And in that article, Rotter goes on to write, fact is, the epidemic worldwide, far from growing exponentially, is slowing, and that was to be expected per what's called Farr's law, which dictates that all epidemics tend to rise and fall in a roughly symmetrical pattern or bell-shaped curve. AIDS, SARS, Ebola, Zika all follow that pattern. So does seasonal flu each year. COVID-19 peaks have already been reported in China, South Korea, and Singapore, but as this entire podcast goes on to say, essentially, well, can we trust any of those numbers? But anyway, importantly, Farr's law has nothing to do with human interventions, such as social distancing to flatten the curve, and indeed predates public health organizations. It occurs because communicable diseases nab the low-hanging fruit first, in this case the elderly with comorbid conditions, but then find subsequent fruit harder and harder to reach. Until more or less now, COVID-19 has been finding that fresh fruit in new countries, but it's close to running out. So while many people assume that China contained its epidemic with draconian regulations, we actually have no evidence of that. Even the New York Times admitted South Korea recovered far more quickly with measures nowhere on the scale of China, although of course the Times still attributes that to human intervention, which assigns no role to Mother Nature. When the coronavirus epidemic ends, and the public health zealots inevitably slap themselves on the back for having prevented their own ridiculous scenarios, don't buy it. This isn't to say that through thorough hand washing several times a day and not sneezing and coughing in others' faces won't help. It will. But without the authoritarian and economically devastating measures the US and other countries are taking that are wrecking the world economy, there will be no apocalypse now or in the future. The streets are empty not because of direct effects of the disease, but from fear and from government dictates, as in a cognate of dictatorship. End quote. And that's what it comes down to. We are living through a period of dictatorship, openly so, where governors who are being questioned as to where they derive the right to shut down businesses or to say this is an essential service, this is not an essential service. Where did you derive that authority? How did that land in your lap? They're saying, well, we're doing it now, and you can ask me later because it's an emergency. It is a dictatorship that is happening right now. Any pretense of any sort of Bill of Rights in the U.S. context or constitutions or any other sort of legal documents in whatever country you happen to live in are being exposed for what they are right now, which is pieces of paper that just have some words written on them, but certainly the people who presume to rule over you do not have to follow them. And I think the underlying point that someone like Rotter is making there is that These numbers are important because this essentially is a narrative that is being given to the public right now on the back of these numbers. Look at this death toll. It keeps going up. Look at these infection numbers. It keeps going up and up and up. And look, we can, if we don't flatten the curve, we're all going to die. And because of this statistical chicanery and these projections and models and all of the other tricks and tactics that I'm exposing here and many, many more that we don't have time to go into, they are creating the narrative that they want. So what we're going to need to do is to lock everybody in their homes, and you will not get out until you have a vaccine or can be proven to have some sort of immunity, and you will be followed and tracked and surveilled for the rest of your life, and we will have to come in and make sure that you have the social credit score with the QR codes and the UBI and everything else that goes along with the Corona World Order in order to save you from the snake god. I mean, from COVID-19. That is the narrative. And unfortunately, what this demonstrates, what the lunacy of the last few months has demonstrated, is that control of that narrative, the ability to create a narrative like that, is the underlying fundamental control of society. Because as I pointed out in Questions for Corbett that was recorded just 24 hours ago, yes, the lockdown is happening in your mind. The lockdown happens because there is mass compliance with it, because people believe these numbers unquestioningly, these numbers that are clearly and admittedly being fudged and manipulated and finessed and generously coded and all of the other words that they use to describe the cooking of the books that's going on right now, because people believe in that narrative that is being forced on us on the back of those manipulated numbers. They will self-quarantine and self-isolate and do all of the things, do anything that the government says. Oh, I needed an immunity passport now? Okay. Oh, we need to get special QR code apps and that'll trace us and give us green or red scores. Oh, okay. All right. Well, I guess that's going to happen now. Oh, mandatory vaccinations? Well, look how many people are dying. I guess we have to do this. So you understand, I think, why it is so important. This is not an academic exercise to question the numbers that are being put forward here. And look, I am not coming down and saying this is definitely this and this is definitely that and this is the real number and this is the fake number. No, I'm saying there is so much confusion being sown right now that of course we do not have a handle on all of these numbers and what they really mean, but that is the point. And the point, again, is that if they can create a narrative, then that is a switch that has been put in place, and they will flip that switch whenever they need to in order to enact whatever political policies that they want, as long as we go along with the narrative, as long as we've demonstrated that we will respond when they flip that switch. They will flip that switch again. Do you think they will not? And it very well could precipitate in a situation where, oh, you crazy conspiracy theorists, you want this lockdown to end? Okay. Lockdown over, everybody out. Okay, everybody enjoyed the sunshine for a month or two, and then, second wave, you crazy conspiracy theorists. See it spreading again. Look at the numbers. Look at the numbers. They're going up again. Look at these mass graves that have been there for 151 years. Look, see what you did, you crazy conspiracy. So if they can control that narrative, then they can control what happens as a result of this. They can create a new second wave, again, out of whole cloth if need be. There are many scenarios that I think we can all imagine playing out as a result of this, but it all comes back down to controlling the narrative by controlling the statistical narrative. I mean, the numbers don't lie is the old adage, isn't it? When, in fact, as we know, there are lies, damned lies, and statistics. So, the underlying point of today's podcast, in case you did not get it, is that no, you should not trust these numbers that are being thrown around at face value. Know that even such a number as the death count, which you would think is a simple question of adding up the number of bodies piled in a room or something, is not that simple. It is a political calculation. It is a judgment that is being made right now, and it can be manipulated to pad those numbers. Please keep this in mind, and please share these facts with other people who are literally melting down and losing their minds over the hysteria that is being generated right now on the back of these lies. Once again, I would like to remind you that all of the things that I'm talking about, all of the articles and videos, are linked up in the show notes. Please go back to the original sources of this. Please go and study what these different experts are saying on both sides of the issue and come to your own conclusions. But I think it is vitally important that we have this conversation right now, because the narrative switch can be flipped on or off if we don't question it.